Welcome back to APAICS Health Summit. I'm Madeline Milka, President and CEO. I'm thrilled to introduce our next speaker, KPAC Associate Member, Congresswoman Jan Schakowsky. Congresswoman Schakowsky proudly represents Illinois' 9th Congressional District and serves in the House Democratic leadership as a Chief Deputy Whip. She is a member of the House Democratic Steering and Policy Committee, House Budget Committee, as well as the House Energy and Commerce Committee, where she serves as the ranking member of the Consumer Protection and Commerce Subcommittee, and as a member of the Environment and Oversight and Investigations Subcommittees. She was a leader in passing the historic Patient Protection and Affordable Care Act to provide healthcare coverage to all Americans, and serves as co-chair of the 118th Congress and the Task Force on Aging and Families. Let's welcome Congresswoman Schakowsky.
Hi, I'm Congresswoman Jan Schakowsky. I represent the 9th Congressional District of Illinois. I want to thank the Asian Pacific American Institute for Congressional Studies for inviting me to be here. I just wanted to tell you that I represent in the state of Illinois, the congressional district that has the largest and fastest growing Asian community. People who are newcomers to the United States, and some people who have been here for generations. And we have a very, very diverse constituency here in Illinois. People from all over the globe, people of every race and religion. And I know that you have your health summit right now, and I'm so grateful for you. It's definitely a top priority for me, and let's face it, a top priority for Americans to be able to get the affordable, quality, accessible health care that they need. I wanted to talk to you about community health centers. I am so blessed in my district. There are 23 of the community health centers that serve people everywhere in all of my diverse communities throughout the Chicago and suburban area that I represent. One of those organizations is called Asian Human Services, and actually they're in 3 different parts of the district, in Chicago and 2 of the suburbs as well. And they provide such incredibly important health care. First of all, they provide it for everyone in those communities who need it. But that would include immigrants and refugees. It includes during the pandemic, when so many of these healthcare providers were available at such a critical and stressful and often dangerous time, to make sure that they were there on the job. They also developed some telehealth, which made it possible for people, and continue to make it possible for people to get their health care. One of the things that has helped the community health centers has been 34B, the provision that makes sure that prescription drugs are available to community health centers at a price that they can afford, and then to pass on at a lower cost to the constituents that need it, to the patients that need it. And I want to tell you that in the Congress, I'm on the Energy and Commerce Committee that includes the Health Subcommittee, and I am always pushing to make sure that we make healthcare more available. I'll be honest with you, I'm for universal healthcare, to make sure that all Americans, all residents of the United States, all immigrants included, are able to get the health care that they need when they need it at a price that they can afford. As the richest country in the world, we need to make sure that health care is available to all. I helped write the Affordable Care Act. I've been in Congress for 25 years. But we still know that there are millions of Americans who can't afford the health care that they need. Fortunately, we've done a number of things like lower for senior citizens the cost of insulin. That's very helpful. We've done a number of things like that. But we have to do more, and I'm sure that your institute is helping us to figure out what are the strategies to make sure that we are going to be able to do what we need to provide health care to all Americans. So thank you so much. I really appreciate being part of your program. Have a wonderful Health Summit.
I'd like to extend a warm welcome to our next speaker, CAPAC Associate Member, Congresswoman Debbie Dingell. She's a member of the Energy and Commerce Committee and the Natural Resources Committee, where she leads on critical issues including affordable and accessible health care, clean energy and water, domestic manufacturing, and supply chain resilience. She is proud to lead the fight for Medicare for all in Congress. Under her leadership, there have been 4 hearings on the bill, the first hearings ever on Medicare for all. She has worked in a bipartisan way to pass the Sustaining Excellence and Medicaid Act, which President Trump signed into law on August 6, 2019, and extends the Critical Money Follows the Person program, as well as critical spousal impoverishment protections that are so essential to so many families. Thank you for joining us today, Congresswoman Dingell.
Hi, everyone. It's Congresswoman Debbie Dingell from Michigan's 6th District. And it's an honor to be with you for APAICS Virtual Health Summit, especially to discuss the importance of community-level engagement in healthcare. It's been a priority for me my whole life. We know that the vast majority of Americans would prefer to receive services and support at home, allowing them to stay active in their communities and live independently. I recently reintroduced my Better Care, Better Jobs Act with Senator Bob Casey, which would enhance Medicaid funding for home care, helping many of the over 650,000 people on waiting lists nationally finally receive care in the setting of their choice. And it would also strengthen the caregiving workforce, improve quality of life for so many families, and boost the economy by creating good paying jobs to make it possible for families and workers alike to thrive economically. Too many right now, caregivers, spouses, need respite care, aren't getting a break, and can't find anybody to help them. This bill would permanently authorize protection against the impoverishment for individuals whose spouses receive Medicaid HCBS. It matters. Too many families have to sell all their assets before they can get the help that they need. And it also would renew or permanently authorize the Money Follows the Person program to support individuals who are transitioning from institutions to home or community-based settings. I'm making this commitment. I'm never going to stop fighting until we can make a promise that no one will have to wait to get the care they deserve in the setting of their choice, and that no care worker will live below the poverty line to provide this care. Right now, we have caregivers working 2-3 jobs, still living below the poverty line. I'm thankful to have all of you as partners in this important work, and we're not going to give up until we get it done.
Hello. The Campaign for Tobacco-Free Kids is proud to sponsor the Asian Pacific American Institute for Congressional Studies Health Summit. For more than 25 years, we have fought to protect children and save lives from the #1 cause of preventable death, tobacco use, and promote proven policies that are most effective at reducing tobacco use and save the most lives. We have made incredible strides to reduce tobacco use in this country, but there is still much work to be done. Tobacco use, as I noted, is still the #1 cause of preventable death, and youth e-cigarette use is a public health crisis. In 2022, 2.5 million middle and high school age students used e-cigarettes. That is unacceptable. As you might know, the 2 leading causes of death among Asian American, Native Hawaiian, and Pacific Islander adults are cancer and heart disease. Cigarette smoking is a major cause of these 2 diseases. In fact, cigarette smoking causes 30% of all deaths from cancer and nearly 32% of all deaths from heart disease. Lung cancer is the leading cause of cancer deaths among AA and NHPI adults. Think of how many lives we can save by further driving down tobacco use. That won't be easy though. The tobacco industry spends billions of dollars aggressively targeting and marketing specific population, including the AA and Native Hawaiian and Pacific Islander community. The tobacco industry tries to appeal to specific populations by making sure their brands are seen, giving money to community organizations, and targeting ads. For example, the tobacco industry has sponsored Lunar New Year festivals and other activities related to Asian Pacific American Heritage Month. The industry has also supported groups serving Asian Americans and others, such as women's groups, political groups, arts and culture groups, and senior citizens groups, with a goal of drawing in Asian Americans and promoting their brand. The tobacco industry promotes flavored products, especially menthol products, in AA and NHPI communities and neighborhoods. Menthol has a minty flavor that masks the harsh taste of tobacco and makes it easier for kids to start smoking. Menthol makes cigarette smoke feel easier to inhale and can make it harder to quit smoking. The tobacco industry has aggressively marketed menthol cigarettes to AA and NHPI communities for decades and continue to do so today. In 2019, 77% of NHPI and 41% of Asian American adults who smoked reported using a menthol brand compared to just 30% of white people who smoked. Removing menthol cigarettes and all flavored tobacco products from the market would protect kids from tobacco addiction, advance health equity, and save lives. The FDA has proposed a rule to eliminate menthol cigarettes. This rule should be finalized and implemented without delay. Over 360 localities have passed restrictions on the sale of flavored tobacco products, and at least 170 of those communities restrict the sale of menthol cigarettes in addition to other flavored tobacco products. We thank you for all of your work and partnership, and we look forward to creating a tobacco-free generation with you.
Our second panel for the APAICS Health Summit is entitled Community Level Engagement in Healthcare. Community engagement is a process of developing relationships that enable stakeholders to work together to address health-related issues and promote well-being, and ultimately achieve better health outcomes. At its core, community engagement can address socioeconomic issues that are the root causes of many existing disparities in health equity. Through a collaborative process, community members, stakeholder organizations, and healthcare providers can work to identify needs most important to the community and pursue meaningful strategies to address those needs. This panel will explore the many challenges and opportunities in developing a successful and sustainable community engagement model. I'm happy to introduce our moderator for this panel, Nguyen, who is a program manager in public health policy at Stanford Center for Asian Health Research and Education. She previously worked as an associate program manager with the Lucille Packard Foundation for Children's Health, where she also co-founded the Asian American and Pacific Islanders and Allies Employee Resource Group to help AAPI employees feel seen and heard. Her prior health consulting experiences included analyzing state and federal healthcare policies with the goal of increasing access to healthcare for diverse populations in multiple states. Let's give a warm welcome to Lee and our second group of panelists.
Thank you, Madeline. And thank you, APAICS, for inviting me to moderate the Community Level Engagement in Healthcare panel today. My name is Lee Nguyen, and I'm the program manager at the Stanford University Center for Asian Health Research and Education. A large part of my work is focused on gastric cancer prevention and education, especially within the Asian American, Native Hawaiian, and Pacific Islander community. I'm honored to introduce our amazing group of speakers today that will be sharing their insights and knowledge. Our panelists are Jackie Leong. Jackie is the executive director of the statewide nonprofit, the Micronesian Islander Community, or MIC, and is an assistant professor at Linfield University. Jackie's background is in public health advocacy, policy, and research. Her work includes working in Medicaid healthcare, access, chronic diseases, COVID-19 wraparound services, and leadership pathways for community health workers. She serves in several leadership positions, including co-chairing the Commission on Asian and Pacific Islander Affairs and serves as a traditional health worker representative on the Oregon Maternal Mortality and Morbidity Committee. She is a Public Voices Fellow of Academy Health in partnership with the Op-Ed Project. We have Rod Liu. Rod Liu is the founder and executive director of Asian Pacific Partners for Empowerment, Advocacy, and Leadership, or APPEAL, a national nonprofit organization created in 1994 to advance health justice issues for Asian Americans, Native Hawaiians, and Pacific Islanders. Rod has over 30 years of experience in developing national models on cross-cultural leadership, community-based research, health equity, and policy change on tobacco and the opioids epidemic. Rod was appointed by the Governor of California to serve on the Tobacco Education and Research Oversight Committee. He has been active with the American Public Health Association, serving as chair of their Public Health Education Health Promotion section. He was also chair of the Asian Pacific Islander Caucus. We have Aisha Williams. Aisha is the head of media excellence and head of culturally inclusive and relevant, or CIR, marketing for the Janssen Pharmaceutical Companies of Johnson & Johnson. A member of the patient engagement and customer solutions team, Aisha leads the critical work to drive the paid media engagement of Johnson & Johnson and to develop and embed a CIR marketing capability across Janssen North America to transform health experiences and outcomes for diverse patient populations. Aisha is also co-founder of the Girl Exec professional coaching series on YouTube and serves on the board of directors for the Research for Action Educational Research Organization. Savine DaCosta. Savine is the health equity lead with the patient engagement, equity, and transparency team within global clinical operations at Biogen. Savine's career spans over 20 years in the pharma biotech industry, including experiences in sales, marketing, patient engagement, and currently health equity. She also has a strong commitment to building trust in underrepresented and underserved communities. This is accomplished through the rigorous identification, creation, and implementation of community engagements. Zoa Vang. Zoa is the current program manager of the Health Equity Initiative program, Hmong Youth and Parents United, where she provides wraparound services to those directly impacted by COVID-19 outreach and community health education. In addition, she works closely with community members to access and navigate health and social services such as Medi-Cal insurance, naturalization processes, and more. She has a strong passion for serving and helping uplift Hmong, AAPI, and other underserved communities in Sacramento for over 5 years. Welcome, everyone, and thank you so much for being here today. Let's kick it off and start with this first question. Describe your organization's perspective on community-level engagement in healthcare. How does it impact the Asian American, Native Hawaiian, and Pacific Islander community? Let's start off with Savine.
Thank you, Lee, and thank you for inviting me to participate on the panel today on community engagement. I'm happy to share my experience as the health equity lead for Biogen, where we aim to build trusted and sustainable relationships with the underrepresented and the underserved communities. We also aim to develop and deliver meaningful therapies for people living with serious neurological and neurodegenerative diseases, as well as related therapeutic areas. Our goal is to empower all patients. Biogen is committed to community-level engagements in many aspects. We work together across policy platforms with educators, with providers, patients, caregivers, in the community, the workforce, with clinical trial sites to build a more inclusive healthcare ecosystem of the future. We work closely with our policy and government affairs teams as subject matter experts on community outreach. We also implement patient-focused drug development to ensure diverse voices, insights, and experiences are built into our drug development process end to end. Part of my work stream also is to go out into the communities and listen very intently to what it is that our communities that we work with feel like they need and that they want as far as community engagement. And then to go in and implement some of those needs and wants into the work that we do. And as it applies to our Asian American, Native Hawaiian, and Pacific Islander communities, it's the same thing. We have to listen to what these unique communities are asking us to do as far as their healthcare, and then go out into the community and implement those needs, wants, and desires in order for them to feel safe and in a safe place, in order to fully entrench into the healthcare environment. We know that that's not a trusted space for them at this point. So what can we do in order to address their needs, in order for them to feel like they can get the healthcare that they're asking for? So basically, there's 2 steps to that: listen and then implement to the best of our abilities. Thank you.
Thank you, Savine. Thank you so much. Rod, how about you?
Thank you, Lee, and it's a pleasure to be here. Thanks for the invitation. As was mentioned, Appeal has been around for nearly 30 years. We were started as an organization nationally to address health justice issues for the very diverse Asian American, Native Hawaiian, and Pacific Islander communities, with a particular focus on prevention. So healthcare is not just about services, but it's also about prevention. And the number one preventable cause of death still is, for our community, as it is for the country, tobacco-related diseases and tobacco and smoking. So with that focus on smoking, we recognized that there was an industry that was targeting our community, and the tobacco industry was really successful in being able to get our population to use a product that is unhealthy and has really damaged our communities. So as an organization, we recognize that community engagement is really taking into account the context in which we're able to deal with particular health issues, as well as striving towards what we would describe as authentic community engagement. And authentic community engagement really is being able to build community capacity and power so that our communities have the ability to determine their own outcomes as it relates to health. And that involves being involved in advocacy and policy change. So we have spent a large amount of our time building community leadership across our diverse communities to create a network of advocates that could speak out on this issue around tobacco, but other health justice issues.
Thank you. Jackie?
Thank you. So Micronesian Islander Community, or MIC, we started in 2011. And when the organization first started, it was about the unification of Micronesians within the state. Now, Micronesians, they're already considered a minority within a larger minority of Pacific Islanders. And then Pacific Islanders are often lumped in together with Asian Americans and Pacific Islanders. So then even the diversity of who makes up Micronesians are left out. MIC's mission is organizing social justice programs to preserve our cultures, while also enhancing our leadership opportunities through unifying our diverse communities. We provide a series of services and programs based on community needs. For example, this includes job training for people who want to become certified community health workers and those who want to serve as healthcare interpreters. We also provide civic engagement leadership training, preparing people to be prepared to provide oral and written testimony at the legislature or at the city council to support our community. We also provide workshops and health services centered on addressing health concerns, from COVID-19 outreach and providing vaccines and testing to tobacco prevention workshops, as well as workshops centered on chronic diseases such as diabetes prevention, tuberculosis programs that also seek to improve the health needs of our community.
Thank you. Aisha, how about you?
Yes, first I want to thank you for the opportunity to partner and participate in this important discussion today on community engagement and health equity. As the head of culturally inclusive and relevant marketing at the Janssen Pharmaceutical Companies of Johnson & Johnson, I'm always eager to share how our community-based partnerships are helping to transform healthcare and the lives of the many diverse patients that we serve. We see that it's through collaborations with organizations such as APAICS that we can advance the work of our J&J, Our Race to Health Equity, which is the program we launched in November of 2020 to invest $100 million to promote racial health equity solutions on our belief that the color of your skin should not be a determinant of your access to care, your quality of care, or your health outcomes. Under ORTHI, roles like mine have taken on an even greater significance as we focus on changing the culture of healthcare in three primary areas that align to our credo as J&J and our commitment to diversity, equity, and inclusion. The first of these is building a diverse healthcare workforce, partnering with universities, hospitals, and healthcare organizations to make sure we build inclusive leadership competencies, educate on cultural differences, and provide our own teams internally with the tools and resources to better reach and connect with broader Asian American communities. The second is investing in and supporting culturally competent community care models. This means that we're relying heavily on community-based healthcare solutions to build trust, which we know is fundamental in the communities we serve, and listening to our community as we work together to improve access and quality of care. And the third is focusing on creating enduring partnerships and alliances. We recognize that no one entity can solve this problem alone. So we're doing our best to lead by example, sharing best practices and lessons learned, co-creating solutions with our powerful partnership network, all in our work to make sure that we serve communities equally and that we encourage everyone to join in the race for health equity. As it relates to the Asian American, Native Hawaiian, and Pacific Islander community specifically, in our oncology division, we see the research from the National Cancer Institute suggesting that racism affects Asian American cancer patients unequally, and studies that show that Asian Americans are unique as the first US population to experience cancer as the leading cause of death. We know that these disparities stem from multiple factors, including historical prejudices against the community, language and cultural barriers, and stereotypes and myths surrounding Asian Americans and racism. We've launched programs at J&J, for example, with our Rybrevant oncology therapy, where we're working with partners who specialize in insights and communication to the community to develop resources with the community in mind and to provide in-language and easily accessible resources within local communities to truly support patients and to meet patients where they are.
Thank you. And Zoa, how about you with the same question?
Thank you so much for giving us this opportunity to also participate in this panel and discussion about the importance of community engagement in the healthcare field. For our organization, I'm from Hmong Youth and Parents United, and I've worked in the community in Sacramento for past 5 years and lived in, born and raised here all my life too. So seeing all of the many social determinants of health affecting our communities have been a very key factor as to what we listen to at our organization here. Our organization was created back in 2008 and revitalized in 2012. Our organization, Hmong Youth and Parents United, was originally focused on bringing together our youth, parents, and community to really invest in our youth and community needs. Understanding that those needs are different in every community, especially in the Hmong community that is a minority within the multiple ethnicities within the API category, and not even the category itself, but the multiple ethnicities and communities that we need to take into consideration when we are working with our patients and considering the health of our overall community. It is important for us to engage and include our community voices and their perspectives on their experiences with healthcare. And we take that into consideration to really invest into understanding where we need to bridge the gap between our community members and healthcare. Some of which, like understanding that we need to reach our community one-on-one, doing direct outreach in the community, seeing them at their doors through like canvassing and other outreach methodology that is not always the most not most practical, the conducting outreach methodology that really reaches our community and really allows us to have a safe space for them to really voice what they're experiencing and what kind of healthcare needs they are in need of, whether that's health insurance or just having a translator be able to help them navigate the healthcare services that are available to them. Understanding and taking all those into consideration, direct outreach and listening to our community needs are very important when considering how we can impact our API community in healthcare. Thank you.
Great. Thank you, everyone, for your answers and the knowledge that you provided with that first particular question. Now, moving on, what are the major challenges preventing faster, more efficient development of community-level engagement in healthcare within the United States? In what ways are your organizations also working to address these challenges? So I'll start with you, Rod.
Yeah, so I mean, I think community engagement, as has been said, is really about trust and building relationships. So our organization is really steeped in helping to grow that, recognizing that our community is in a situation now where we're facing a lot of anti-Asian hate, and it's difficult to do programming because there's fear of what's happening. This is nothing new, and it's important to take into account historical context whenever we're dealing with any type of health programming or healthcare. And so that's what we do, is really kind of look at that context and figure out how to help build community power so that there's the ability for communities to kind of take action. Now, one other challenge is really what we would describe as, systemic racism and institutional racism, where systems have unfairly targeted our communities and created situations where it's difficult to overcome challenges. And one of those issues is around what we call data disaggregation. The fact that there are certain information about our community, which is a very diverse community, that's lumped together. For example, combining Native Hawaiians and Pacific Islanders with Asian Americans. Those are two separate racial groups and should be addressed individually. But even within each of those racial groups, there's a lot of diversity, and we need to kind of build the ability of each of those communities to respond, to be able to overcome the perception that we are a healthy minority, a healthy model minority. And so what we focused a lot is on equity. And I think it's important for us to actually describe what equity means, because it's talked about a lot and it's used very differently among different individuals. For us at Appeal, equity is about, one, building community power. And we've done that through building our community leadership program. We've trained over 1,500 individuals and advocates across many different priority populations. And secondly, addressing systemic change. And systemic change isn't just about doing kind of transactional change. It isn't about just providing services, but it's actually working towards what we would describe as transformative change. And that's even beyond transformational change. It's the ability for communities to determine what their outcomes are going to be. And some of that is really related to social determinants of health and creating funding for community-based organizations to be able to implement some of these successful strategies that have been done over the many years. And that example that we are involved in California is the Health Equity Racial Justice Fund, which would be for all racial communities. to combat inequities as well as systemic racism.
Thank you, Rod. Savine, how about you?
Thank you, Lee, for the question. And thank you, Rod, for your comments as well. I have to agree with everything that you said. And I just want to add on a few layers to the challenges that Rod mentioned. The financial concerns, the access issues, the mistrust in the healthcare system, misinformation or inadequate information about healthcare, and clinical research, if I could add that from my clinical research background, opportunities to participate in clinical research, access to healthcare providers and specialists in the communities, logistical concerns, recognizing some of the biases that Rod has even spoken about when he spoke, inequities at the community level. And even just getting to know the community before people ask something of the community is an issue. Enhancing communication at the community level, just even basic putting things in the language of the community that you're trying to communicate with, and just being more inclusive when you're trying to build programs, including the people in the community that you're trying to communicate with before you even build the program. A lot of times we do things and we plop these things in a community as if we even understand and know what it is that they want without even asking them first. These are challenges that we have. In what ways are Biogen working to address these challenges? We work from end to end with a community advisory board that's inclusive of a diverse racial, ethnic background of people, age, gender, disability. No matter what we're trying to do, we go to that group first and we ask them and we listen and we take the insights. And that includes people of all backgrounds. We have educational resources that were co-developed with this group of people. They're priceless. Their input and their feedback, we just can't do anything without them. And I'll just give you a specific example of what we've done. We have something that we call the Participants' Rights Timeline. And one would think that, why did you do this? What we've done is we've taken some rather unseemly events in clinical research and we put them on this timeline because we felt like that was where there was a pocket of mistrust. And then we said, this is why people aren't participating in clinical research. But what we also did is we said, what is the medical community's response to this to show people that they could be safer in clinical research? So instead of shying away from the issue, we brought it to the forefront and we took it to this community advisory board and said, what are your thoughts? How should we change this so that it could be more accepting in the community? And now it's out there, ready for people to look at and comment on, and hopefully show them the evolution of safety in clinical research. And that included people of all walks of life, ages, disabilities. The primary objective, like I said, of that board is that we listen and that we learn and that we grow from it. The other thing we do is we actually recognize ongoing issues and try to talk to patient advocacy groups in the communities in which we want to work. Because the definition of insanity is doing things the way we've always done them and expect a different result. We have to change our approach if we want to do things and work with different communities. And that's something that we're trying to do with our outreach. We've been able to do, for me and the work that I do, from December till the end of March, we've been doing, we will have done at least 26 different community outreach programs. And that's just doing disease education and education around what clinical research is in communities across the United States without asking for one thing in return. We haven't earned the right to ask for anything. People want to understand where they are in their disease journey, and we just want to teach. And that's part of it, collaborating with communities, understanding where they are, and just going out there and listening and learning from them, and then moving forward and sustaining a presence in these communities and not being transactional about it. Going in and then disappearing is not helping anyone. And I think Rod made some of these points as well, so that's a big part of it. And for us at Biogen, we need to place clinical trial sites in these communities so that this care is accessible for them, and they have people that look like them, that are humanistic in their approach, and they feel like they're cared for. And that's a big part of the work that we're doing and continue to do. And as long as we have that bi-directional feedback and we can work together on this journey, we're going to continue to pursue this to the best of our ability.
Thank you, Savine, and thank you, Rod, for your answers regarding the challenges and how your organizations, but both of you are also combating the challenges that we're noticing with community level engagement. I'd love to hear now some of the opportunities that we have with this work. So what are some of the opportunities and future possibilities that our communities should be excited about? I'd like to start with you, Aisha.
Yes, one opportunity we're excited about is our Johnson & Johnson My Health Can't Wait program. It's a patient education effort to inspire people to prioritize their health with confidence. It's truly a public information effort and a resource hub that provides patient and healthcare providers with valuable tools to stay connected and to prioritize needed care. It was developed to help individuals understand the importance of addressing their healthcare needs and to recognize the potentially detrimental impact of delaying care. We believe that through expanded community engagement, these resources will help to ensure that patients and providers have access to information, education, and community resources aligned to our spirit and all that we do in our culturally inclusive and relevant programming to meet members of the community where they are and to enable access to care. And as to what has been stated so beautifully throughout this discussion, the materials that we present to the community will be those that are rooted in true, culturally inclusive and relevant insights that have been designed with, for, and by the communities that we serve, and that we hope will do tremendous impact as a service for better and more equitable healthcare.
Thank you, Aisha. I'd love to hear from you, Zoa.
Thank you. In response to this question, what our community can definitely look forward to as opportunities is a lot of nonprofit organizations or community-based organizations are really expanding and learning to strengthen their partnerships with cross-sector partners, such as other nonprofit organizations, other city, county, state level, national level partnerships to really expand their reach and understanding of how we can best reach our community and streamline those community voices to across the board with those partners, as well as working with like hospitals and healthcare systems, and making sure that those community voices that we hear at the community level are brought up to the meetings that we have with our partners, and they actually hear and listen in on what needs to be done to ensure that our community members are getting the healthcare services and healthcare experiences, quality healthcare experiences that they all deserve and need to live their best qualities of life. That's all. Thank you.
Great. And Jackie, how about you?
Now, this is a great question. There are many opportunities to be involved. First off, getting engaged and knowing that your voices are needed. We need Micronesians of all ages, our youth and our elders. The Micronesian community is growing, and we're seeing a large increase of Micronesians who are also COFA citizens. For people who don't know what COFA stands for Compact and Free Association. And these are individuals who are Micronesian COFA citizens, including the Federated States of Micronesia, which has 4 island nations, including Chuuk, Pohnpei, Yap, Koshrai, Republic of Marshall Islands, and the Republic of Palau. Under the COFA Compact, COFA citizens are allowed to travel freely between the US and the respective island nations, which is their passport and I-94. They're allowed to work, own property, and go to school. But in return, there's US military occupancy on their islands, as well as, let's not forget, the horrific bombings on Bikini atolls of the Marshall Islands. The compact also guaranteed key specific services, but due to the Welfare Reform Act, this was removed. For example, for nearly 25 years, Medicaid was not available for COFA citizens, despite it being promised to them under the compact. But finally, in December 2020, Medicaid was restored, but the long-term inability to access health care has resulted in significant untreated health conditions that are now presenting itself as chronic diseases and illnesses, resulting in higher death rates. We at MIC encourage people to be involved. Learn who are Micronesians, including COFA citizens, and why our COFA community is one of the most vulnerable communities in the US. We encourage you to connect with our Micronesian leaders and to learn about the rich diversity of the communities and hear their stories. For example, at the state level, MIC is moving forward with the Oregon-specific bill to bring SNAP benefits to all Oregonians, including COFA citizens. This bill is in the state legislature right now, and we're working together as a coalition to make this possible. And this is one way we're moving forward for our community. We encourage others to get involved and advocate for your community's needs and services. So health equity is centered first and foremost on the communities with the greatest needs.
Thank you, Jackie. And really, Jackie, you kind of set us up for the perfect closing out to this discussion with our last question. The last question today is, could you all share one idea or action you'd like the audience to take away from this panel today? I'll let everyone share something about yourselves or your organization with everyone. We'll start off with Zoa.
Yes, I think something that we've all the panelists have really mentioned today as a key practice that we should move forward with all the partners and organizations involved with healthcare and changing and improving and transforming our healthcare for our community is really to truly listen to our community members, meeting them where they are at, and taking their advices and experiences and incorporate that to the work and kind of healthcare services that we intend to provide, so that we are working together to truly create the kind of healthcare that serves all of our communities and really meet their needs and encourage and lead us to having the best quality of life for all of our communities.
Thank you. Rod?
So there's two words that come to mind. One is collaboration and the other is reflection. Collaboration really is about working across all sectors. And for us, that's 4 levels of change that we feel needs to be a focus of any type of transformative change. It's the community level, the administrative level, which are like health departments, policy level, which is like through legislation, and then the corporate level. For us around tobacco, that's combating the industry, but it also can be partnerships with other corporations. And this comprehensive approach is really necessary for us to really get through all of the barriers that are resulting from systemic and institutional racism that has perpetuated throughout the system. The second piece is really reflection. And, when I think about what the most significant part of this panel, I think, is really around how do we do authentic community engagement. I think about, talking with colleagues who ask us to do something. And when you have that relationship, you don't even think about it. You just respond and will do anything is necessary to help to support them. And it's the same way with communities and community-based organizations. If there's that trust that's built in, it's ready-made and it happens. So for us to be able to get there, we have to really reflect deeply about the history and how things have happened, but also our approach to doing things. We used to have a focus on cultural competency, which was about learning everything possible about every single community, and that's impossible to do. And now it's really about equity. It's how do you incorporate principles of equity within the system to create the change that you want to see. And oftentimes that requires many of us to ask ourselves difficult questions, to be in a position where we're comfortable with being uncomfortable when it comes to having the necessary dialogue it takes to create the change we want to see. We've been working on this for decades, and some things have changed and some things haven't. And in order for us to actually move things, to move the bar, there really needs to be some type of transformative change. And that can only happen when communities are empowered, and community-based organizations are a big part of implementing that change.
Thank you, Rod. Jackie, same question for you as well.
My 2 cents here is share your stories. Whether you're comfortable writing or speaking, share your stories. Speak in the comfort of your language. Micronesians, for example, are an oral community, and we're also extremely humble. I encourage you all to use your voice and amplify your experiences. Tell your story, write testimony, write an op-ed, write a letter to the editor, speak at a council or a upcoming meeting. And when or if you feel ready, look into being that change. As Rod just said, be the change you want to see. So be that change. Join a board, a commission, or a committee. Run for office. Be that somebody. For example, growing up, I did not have that someone. No one looked like me in office, and no one talked to me about leadership opportunities. And I decided I wasn't doing that anymore. As a mother, as a caregiver, as a student, as a survivor of violence, and someone who served in office, I call on you to speak out and inspire others so that they themselves see that there is someone who looks like them and who follows their values and their convictions.
Thank you, Jackie. Sabine.
Yes. A big thing for me is education. Education is power. And if you educate yourself on your condition, on your community, on what it is, where you want to go, how you want to get there, that is a powerful tool that you have. You can then use your voice. You can then advocate for yourself. You can advocate for your community. Then you understand how to share your story. You can understand so many different avenues you have and where to go, how to get there. Participate. As Jackie, as Rod, as was said, and I'm sure Aisha will share. Aisha, sorry, say your name wrong. It's just so many different community programs that are happening these days. Throw your hat in the pool of things that are happening. Don't just sit back and watch everybody else. You matter in this whole equation of everything that's happening. Make this a bi-directional discussion and make sure your voice is heard. And that is the only way that progress is going to happen. This has taken a long time, and we're like an inchworm watching things happen. And for progress to happen, everybody needs to participate to make this change happen. So share your voice, educate, empower yourself, and make this a generational change. What we've seen stagnated is for so long, generations upon generations have just said, this is how this is going to be. We have to make this happen differently. We can't just keep letting things happen the same way that they've always happened in the past. And in order for that to happen, people really need to be educated on what's happening today and make things different for tomorrow. Thank you.
Great. Thank you, Sabine. And Aisha, how about you to close us out?
What a powerful conversation. My last words would be that clearly we are stronger together. Representing Johnson & Johnson, we're keenly aware that no organization can tackle this important work alone. And I think it's critical that as organizations, large and small, we must partner with and learn from other organizations, government entities, corporate and community partners who have been doing this work in the communities that we're embracing today for decades. And I just believe that when all of the communities we serve have a seat at the table and we can engage in partnerships and dialogues like those that we're having today, It paves the way for us to advance health equity and to truly address systemic problems in a systemic way. So thank you so much for having us at your table today for this important discussion.
Thank you, Aisha. And thank you everyone for this dynamic panel. It's been truly amazing and I've learned so much from all of you. I'm very motivated now to get out in my community and be uncomfortable with community engagement and engaging with different voices and perspectives that we may not always hear from. Some themes that I noticed today as well from everyone speaking is really trying to understand the lived and direct experiences of the communities that we live in, we work in, and we serve in, building trust within the community, and really incorporating diverse perspectives into the decision-making process to make things more equitable overall. So I really just want to say thank you to everyone here, all of our panelists, for the knowledge and takeaways of this discussion today. And thank you again to Madeline, APAICS, and also the audience for listening to our discussion. I hope you have a wonderful summit.